It's true that in Australia we've got a fabulous cervical screening program. And in fact, it's very important that people understand that having the vaccine is not a substitute for having a Pap test. What the vaccine does is it prevents you from being infected with certain types of HPV, and it has the potential to prevent about 70% of cervical cancer. But in fact, the other 30% of cervical cancer can be caused by other HPV types, and thus it's very important to keep on having Pap tests done. What the Pap test does is the Pap test actually looks for infection that's already present, infection that the woman has already acquired. So when you have a Pap test done, what we're actually looking for is we're looking for changes in the cells on the cervix that might indicate it that you've had an HPV infection, and if this looks like a significant infection, then that might need to be treated. But what we're doing with the vaccine is we're getting in a lot earlier. We want to prevent infection to begin with. So in fact, giving the vaccine is a fabulous way of preventing infection and preventing these abnormalities from arising. It's not just cervical cancer that we worry about in these cases, but in fact, many women will know how distressing it is to have an abnormal Pap test. It causes an immense amount of anxiety, concern and worry, and in fact, then women might have to go off and have further investigations done and have treatment that on their own can cause complications. What we want to do with this vaccine is prevent infection to begin with, so that women aren't in the situation where they develop Pap test abnormalities. So having the vaccine means that your daughter will be prevented from developing other HPV related illnesses like genital warts, and from the majority of Pap test abnormalities and cervical cancer.